recognize the gentleman from Pennsylvania, another one of the doctors on our subcommittee, Dr. Joyce.
Thank you,
5
Madam
minutes to
Chair.
question.
Mr. Secretary, I'd like to ask about health care access. Since your department says that that's a priority in the recent RFI on access to care and coverage in Medicaid and CHIP. In that RFI, CMS asked for feedback on ensuring access to timely providers and services. So I would like to know, do you think it would be in the interest of Medicaid beneficiaries if a state were to restrict access to providers of mandatory services so that only hospital in their county or service area in their region would be able to provide Medicaid services?
Dr. Joyce, I want to make sure I understand the question. You're talking about a program where Medicaid would compel the restricted access of services?
Compelled only to be with hospitals that had eligibility requirements by whether or not their hospitals were unionized.
So if there is a requirement that's based on a level of care, or if there are criteria that are imposed before a hospital or other provider can make use of Medicaid services, it may be as a result of an effort to make sure that the care that will be provided is of quality. I'd have to have more information to answer your question more directly, but certainly Medicaid is in the game of trying to increase access, not decrease access to care.
And if access was decreased because in rural areas or throughout the Commonwealth of Pennsylvania, hospitals are not unionized and thus would not be able to accept Medicaid patients and would then sever the services that are available for those Medicaid patients, would that be unacceptable?
We certainly want to make sure that Medicaid is supporting hospitals or providers that offer quality care. And we want to make sure that we keep Americans and patients away from facilities, providers that don't offer that level of care that we would expect, because not only would it be bad for the patient, but it would be bad for taxpayers to be providing care in that way. So again, knowing the particulars would be helpful to be able to give any specific response to any particular provider.
So earlier you stated that you're committed that Americans stay healthy. I share that commitment. Americans who rely on Medicaid for health care need to have access to care. As you know, per the letter that I sent 2 weeks ago, my home state of Pennsylvania is preparing to prohibit MCOs from contracting with hospitals and other providers that had a work stoppage in the past 5 years if the provider doesn't have a collective bargaining agreement or labor peace agreement in place. This provision would not only be inconsistent with your recently published RFI, but it would also appear to be in violation of existing Medicaid statutes, including 42 CRF 438.206, availability of services, 42 CFR 48214, provider selection, 42 CFR 438.12, provider discrimination prohibited, and a large amount of regulations and guidance that flow from these laws, notably time and distance standards, network adequacy in particular, as well as a state guide to CMS criteria for Medicaid management career contract that your agency just released in January of this year. With that information, I would ask you, Mr. Secretary, would you be prepared to reject a contract amendment, or a state plan amendment that undermines access to care by denying Medicaid beneficiaries the access to only hospitals in their county or in their service area?
Congressman, let me commit to you that we certainly are willing to work with you if you believe that there is a state plan for your state of Pennsylvania that is not working in the best interest of any Medicaid patients. Certainly we will take a close look at that. We're in the process of reviewing any number of requests from different states on how they implement their Medicaid program. We always, as I said, try to make sure that we move towards increasing access to care, quality care for those patients who would receive it through Medicaid.
Thank you, Mr. Secretary. I look forward to working with you on that issue. It is important and it is beneficial that Medicaid patients have access to more facilities regardless of the presence of qualifying relationships with organized labor. Thank you for agreeing to address that with us.
Gentlemen, you